Hi, everyone. Today we're talking to Mignon Fogarty on this episode of The House Called Doctor. We're going to be talking about RLS, which is short for Restless Leg Syndrome. Last week we talked about some possible treatments for RLS, and today Mignon is actually going to share us her experience with RLS personally, and she's going to ask me some questions, and we're going to answer it in hopes of helping all of you.
Hi,
Hi, Mignon.
Sanaz. When I was in graduate school, my legs started getting twitchy, and I was really scared because at first I thought maybe I had multiple sclerosis or Parkinson's or some really serious neurological disorder. So I went to the school doctor, and they told me I actually had restless leg syndrome. So I was wondering, I was really relieved, and I was wondering, is it normal for it to come on sort of suddenly like that in your late 20s? And then actually, after I had a name for it, I was talking to my dad, and he said, "Oh yeah, I have problems with twitchy legs too." So is it normal for it to come on in the 20s and to run in families like that?
Actually, yes. RLS does tend to run in families because it does have a genetic component to it. So if you ask your family members, more than likely you'll find at least one person who will tell you that they suffer from RLS symptoms to some extent. Seem to get more frequent with age, and patients will tell you that actually the duration of the symptoms will increase through age. But most patients, when you ask them when they first started having symptoms, they'll tell you it was sometime between age 11 and 20, although most patients are actually getting diagnosed later, around age 40, because by that time the symptoms are more severe and it's inhibiting, quality of life at that point. So that's when they actually seek help with the doctor.
I see. And so I can go for weeks or maybe even a couple months sometimes without having symptoms, and then it'll just come on again. And I've noticed that it tends to happen when I'm really, really tired. So is that normal too, for it to be erratic and for it to be worse when you're tired?
Yes, actually, definitely. So RLS patients actually, some of them will actually go through periods of remission. So it'll be, anywhere between weeks and months even. And however, that does tend to be a little bit more in earlier on in the stage of the disorder. But yes, that can definitely happen where you'll go through periods of remission. And then fatigue is actually a really well-known trigger for RLS. So that's why doctors will say, make sure you maintain a good sleep-wake cycle. So meaning, sleep at the same time every night and wake up at the same time every day as part of your treatment for RLS.
Oh, interesting. And it's good to know I'm normal. Okay. And then
Yes, you are.
one of the other things I noticed is when I take antihistamines like Benadryl, I have bad hay fever, and when I take Benadryl, I've noticed my legs get more twitchy. And is that a known connection? It seems weird to me.
No, actually hit it right on the nail. So, sedating antihistamines actually have also been known to be a trigger for RLS. So, for most patients, they're sedating. However, for some patients with RLS, they can actually do the opposite and they can be more activating. So, we tell patients who actually suffer from allergies and who also have RLS to actually use non-sedating antihistamines. So, examples are loratadine and cetirizine, which are the generics for Claritin and Zyrtec, which are over the counter, just like diphenhydramine or Benadryl. They actually last a little bit longer, so that's even an extra benefit.
So before, I said I was scared when it first happened that there was something seriously wrong with me. But as I've gotten older, I've started wondering, well, okay, it's not so bad now, but does it mean I'm at increased risk for other problems, neurological problems, as I get older and it progresses?
Right, that's a good question. So, for most people, no, but there are a few things that RLS has been associated with. One of them is iron deficiency anemia. So, when patients first come in with RLS symptoms to the doctor, we actually do a little blood test for anemia, and we'll check something called ferritin, which is the body's, it's a reflection of the body's iron stores. So, when this level is less than 50, if you treat the patient with iron supplementation, actually, sometimes their RLS symptoms will improve. So that's one thing that has been associated with. Also, other people with other neurologic symptoms, so like Parkinson's or MS, they actually will have higher risk of developing RLS also in addition to their health conditions. But again, most people with with RLS do not suffer from any of these things, and they're not at risk for getting any of these things.
Okay, that's good news. So, I never thought about it before until you and I started talking about this, but I always have trouble sleeping at night, and I've found that audiobooks really help. And I've never made the connection, but I was wondering if somehow the audiobooks distract my mind and somehow keep my legs from twitching. Is that possible?
Yeah, actually, so what we do know about RLS is that it actually occurs at rest. So when you're trying to relax. So for most people, that means nighttime when they're trying to sleep. So I'm actually not surprised to hear that the audiobooks are helping to distract you and deterring your RLS symptoms. And I think that's great. So you found a way to actually deal with your RLS, I think it can be a great tool. The only thing I would wonder about is if someone was listening to an audiobook that was too activating, like if it was a horror, storyline or like a action or something like that, then it may kind of do the opposite. But I think that's a great tool as long as you are still able to relax and enjoy your audiobook at the same time. I think it would be a great way to distract yourself.
Yeah, it's only when the book is too good that then I have trouble going to sleep when I get
Exactly.
too involved. Well,
Exactly.
thank you, Sanaz. It was really interesting to get my questions answered. I've never actually talked about it with my doctor because it's just this sort of ongoing thing that never is bothering me more at one time than any other. So, the iron thing was really interesting. I'll ask my doctor about that now.
Yeah. So honestly, most patients with RLS, they don't even know they have it. And they end up getting diagnosed way later in life. So the fact that you even figured it out so soon and you also figured out how to manage it using the audiobooks, I think that's great.
Super.
Well, thanks so much, Mignon, for joining us and for sharing your experiences with us. So, for all of you listening out there, if you also suffer from RLS, share your experiences with us on the House Call Doctors Twitter and Facebook pages. In addition, we wanted to let you know that we actually have a Restless Leg Syndrome homepage where we're going to talk about more causes, treatments, and more symptoms of RLS if you're interested in learning more about it. So I also always note at the end of every one of my podcasts that the content here is really strictly for informational purposes only. It doesn't substitute any medical advice and it doesn't substitute any medical reasoning by your own personal health provider. So always seek a licensed physician in your area regarding all health related questions and issues. Well, thanks so much for joining us. See you next time.